Okay, so this is the peripheral nervous system, lecture 1. There's the objectives. This just gives us a breakdown, something we already saw in chapter 10 of what the peripheral nervous system, or the divisions of the nervous system. So we got the central nervous system, that's the brain and spinal cord. Then you got the peripheral nervous system. And we really didn't talk a lot about this in chapter 10, that it's the cranial nerves and the spinal nerves. And the cranial nerves come from the brain, and then the spinal nerves come from the spinal cord. The sensory nerves conduct impulses into the brain or spinal cord. These sensory nerves are those afferent nerves. Afferent nerves. And then the motor nerves were the efferent nerves with the E. Mixed nerves are a combination of both of them. So the mixed nerves, most of the nerves we have in our body are mixed nerves, where they're conducting impulses to and from the central nervous system. All of our spinal nerves are mixed nerves, except for the first pair. Okay. Cranial nerves. Cranial nerves are designated as CN. So, cranial nerve, and then a Roman numeral, CN1 is the olfactory one. Cranial nerve 1, the olfactory nerve, it's a sensory nerve, and it transmits impulses associated with smell. So it's sensory and transmits impulses associated with smell. So this one's going to go from the olfactory bulb to the brain. Cranial nerve 2 is an optic nerve, also a sensory nerve, and it's transmitting from the eye back to the brain, and it's the occipital, back eventually to the occipital area. Cranial nerve 3 is the oculomotor nerve. So think of what oculo sounds like. Oculo sounds like eye, motor, moving. It's primarily a motor nerve. And this sends motor impulses to muscles that are going to raise the eyelids. So raise the eyelids, moves the eyes, focuses the lenses, adjusts light entering the eye. Those kinds of things. There are some sensory parts of that nerve that are more, the sensory parts are more proprioceptive. The cranial nerve 4, trochlear nerve. It's primarily a motor nerve. It's motor impulses that move the eye. And then once again, there's some sensory things in here that are proprioceptors. See if I can write that a little neater for this time. Good. Cranial nerve 5, trigeminal nerve. It's a mixed nerve. This nerve is called the three sisters. Okay, it's called the Three Sisters because you can see that there's three parts to it. You've got the thalamic division. Oops. Which is sensory from the surface of the eyes, your tear glands, scalp, forehead, and upper eyelids. You got the maxillary division, which is sensory from your upper teeth, your upper gums, upper lip, palate, and the skin on your face. And then the third sister is the mandibular division. And think about where the mandible is. So that's sensory from the skin of your from the skin of your jaw, your lower teeth, lower gum, lower lip, but also your scalp. There's also the motor part of that, which is to the muscles of mastication and muscles in the floor of the mouth. Cranial nerve 6, abducens nerve. That's primarily motor. And it has, abducens has motor impulses that move the eyes. Some sensory, once again, as proprioceptors. Cranial nerve 7, the facial nerve, is a mixed nerve. So it's mixed. It has sensory from the taste receptors. And motor to muscles that cause facial expression. Motor, facial expression, motor also to tear glands and salivary glands. Cranial nerve 8, vestibulocochlear nerve. Vestibulocochlear nerve has had, also known as the acoustic or auditory nerve. It is a sensory nerve. 2 branches. The vestibular branch and the cochlear branch. The vestibular branch has sensory for equilibrium, so your balance, and then the cochlear branch is for your hearing receptors. Cranial nerve 9, glossopharyngeal nerve. It's a mixed nerve. And it has sensory from your pharynx. Remember, pharynx has that weird spelling. Tonsils, your tongue, and your carotid arteries. Motor to your salivary glands. And the muscles of your pharynx. Cranial nerve 10 is the vagus nerve. Vagus nerve notice, makes a pretty steep dive. It's a mixed nerve. It has somatic impulses. So remember, somatic are those voluntary to muscles of the speech and swallowing, and autonomic to your viscera in your thorax and abdomen. There's also sensory functions, sensory to your pharynx, your larynx, the sensory to the esophagus, and then sensory from your viscera of your thorax and abdomen. Cranial nerve 11, the accessory nerve. I feel like when they got to 11, they just ran out of names, so they started throwing in whatever they could think of. 11 is primarily a motor nerve. It's also called the spinal accessory nerve. And you can kind of see why. Look where it runs. So the spinal accessory nerve has a cranial branch that goes to, that's motor to your soft palate, your pharynx, and your larynx. And then it has the spinal branch. And the spinal branch goes to the muscles in your back and neck. And there's some sensory. Once again, the sensory is just proprioception. Cranial nerve 12, hypoglossal nerve, primarily motor, and it moves the muscles of the tongue. And then the sensory part is proprioception again. Okay, there's your table, and that table has pretty much everything we just talked about. When you're studying this, I would find a way to maybe use some flashcards or Quizlet or something, and the other thing is find things that are common, like find the fact that maybe you can learn all the sensory nerves together, and then learn all the primarily motor nerves together, and then the mixed nerves. So if you do that, primarily motor. If you do those, then it's not so much. It seems easier to learn because you get the 3 sensory, the 5 primarily motor, and then the 3 mixed. Okay.